hospital. I think that was in 2013, July of 2013, when I first got sick. You know, went to the hospital and they told me my heart was enlarged, my prostate was enlarged, and I needed to go to the cardiologist right away, cease the physical activity in sports. And that triggered like a domino effect of going to the doctor. That discouragement of going to so many different appointments, getting surgery to remove lymph nodes from my abdomen, from my vocal cords, off, you know, out of my throat here, take some lymph nodes, bone marrow biopsies, and then not having conclusive results, not having a diagnosis. It would have been easy to kind of cash it in. I feel like because of the way that you raised me, the experiences, the patience, the forgiveness, all of those things has helped mold me into who I am today. So I just want to say thank you. But ultimately, it's not about us. It's not even, you know, it's not about us. It's about creating awareness and showing other people of color and just other people in general, you know, what this can look like and how important it is to have positive role models in your life. A big reason that I'm still here today is because I had you guys as positive role models in my life that I always saw go to the doctor. I always saw prioritize your own health. So it was just something that that was natural for me. And I, you know, as I've grown up and I've gotten to meet more people and go to other places and talk to other people and hear what their experience has been like, that is not the case for everybody. And for a lot of people, unfortunately. But so I felt like, you know, what a great opportunity for me to, you know, put a spotlight on this and just let people know like how impactful and how imperative it is to your overall health span and longevity, like the quality of your life and the length of your life, to prioritize yourself, to go get checked. What motivated you or what drove you to prioritize your health all of those years, to go to the doctor and to get prostate exams, you know, in the middle of the workday?
That's how I was raised. My parents didn't have a lot of money, so we used to have to go to Children's Hospital our early years. And so I was raised to go to the doctor and get a physical. And then being in the fire department, you always had to be physically sound, and that was another stone for me. And when I went to Great American, first thing they said was hospitalization. We can get you. You know, I said, well, I got this. And they said, no, we're going to give you ours as well. So it's been easy for me because I've always worked and always had insurance. So going to the doctor wasn't, it was an inconvenience, but it wasn't costly. You know, and it was for my own benefit. And that's why we raised you that way. Let's go to the doctor, get it checked out. You start coughing, we'll give you a little cough medicine. That didn't work, we're going to the doctor. That's just the way we are. It's important that everybody goes and get a checkup, and don't be afraid of the prognosis. Be afraid of not knowing and not doing anything about it is the wrong way to go. If you got something wrong, figure out what it is. Medicine in today's world can do a lot of things, a lot of things.
I'm so grateful because that's something that I could have easily, you know, probably as a kid, like I didn't understand that. But like now I'm like, man, that was just, it was a lifestyle. It was just ingrained into like my DNA. I'm just extremely grateful that was my experience and what I was exposed to coming up. So thank you for that. I'll never forget that you had cancer, but our experiences were vastly different. You know, you got three main ways throughout the medical world that you can treat or try to, you know, combat cancer, and that's typically surgery, radiation, or chemotherapy. And you went all those years, right, and got these exams. Like, did you ever have anything come up while you were going to get your prostate exams? Like, did they ever have any signs or symptoms along the way that, like, warnings?
It really was a shock to me, to be honest with you, because I always go to the doctor annually. If I got sick, I go to the doctor because I work for that. You know, and the insurance is there, so I would go. And I went for a routine urology doctor. And he said, something ain't right. And they did a biopsy, and they said, well, you have prostate cancer. So I said, well, what do we do? He said, well, you can live with it, or we can take it out. And I said, take it out. And it's just, you know, people make such a big deal of things that aren't necessary to have a happy life. You know, health, good health, and peace of mind are the two things that you need the most. Everything else is just like gravy on potatoes. You know, it is.
I love that.
It is. That's the gravy of life. You know, so I got a little less gravy, but I still got life. And so it wasn't a hard decision. It wasn't an easy one, but I did what I thought was the right thing to do.
I feel like it's so powerful to have the example of both of you, but then also, you know, you as a strong Black man, prioritizing your health and not letting whatever stigma or what other people think, like, that is why you're still here with us, you know? And I'm extremely grateful for that. So you had surgery, they removed the prostate, and I'm sure that was extremely, you know, challenging as well at different times. Like, if you don't mind, share a little bit about like what that experience has been like.
Well, it's the hardest part is when you get the diagnosis, and then when I prayed about it and thought about it, it wasn't that big of a deal. I'm still here. I'm still living. I still have fun. I'm still got my wonderful wife. It didn't change my life. It didn't make it worse. It didn't make it better. It's just something that happened. And I was raised that God don't give you burdens you can't carry. So I just carry it. And I don't worry about it.
Yeah.
I wake up every day, happy to be alive. You know, got my faculties about myself. It's a great day.
Understand, but because he acted so quickly and was going to the doctor, it had not gotten to the prostate wall.
Yeah. One of the things that cancer survivors often continue to combat is test anxiety or scan anxiety. Have you ever heard of that before? Yeah, so just like, you know, you got to go quarterly, and some people, like, that's a lot for them. It works them back up. It has them relive all of these things that, you know, were pretty traumatic. And I have different things that I've developed in my own, you know, routine on how to handle that and combat it. Do you ever have any scan or test anxiety, or do you ever worry?
No, they say you need to come get checked. I go get checked. That's all I can do. I'm not a doctor. I don't know medicine. So I can't judge. If he says I need to be checked, I'm paying money to tell me what I need to do. So I do it. You know, it's just that simple. A lot of people, it's denial. They don't want to be sick, so they try to deny it, you know, as much as they can, put it off or push it back on the back page. I'm not that guy, you know. Now, I don't go to the doctor every time I get a cough or a sneeze or something like that, but I do go get regular checkups, and if they find something, we do what we can about it, you know. And it was a blow, but he said, well, we'll take it out. I said, okay. And I'm still here, and I'm still living and happy and have a full life. And so that is what I do as well in between my appointments and before I go in.
we talk about this, managing our expectations, you know, really managing my expectations, but objective thinking, neutral thinking, just telling yourself the facts. The facts are, I feel good. I have everything I need to win the day. You know, I'm loved, I'm provided for, I'm safe. And right now I don't have cancer to my knowledge. No one's told me that. And so I'm going to move and operate as if I don't have cancer. And if that comes up again, when we get to that point, then we'll deal with it when that happens. But often, so that scan anxiety and that test anxiety can just manifest. And honestly, I feel like sometimes that can lead you back into a resurgence of cancer, because you're living in a state of almost like toxic stress and anxiety. And that's
negativity.
The negativity. And honestly, as I continue to learn more about this, like when you're in a state of toxic stress and worrying about those things that you can't necessarily control, your immune system's down. And that's when like you create an environment for, you know, disease to come back up. You know, as I think about that, the medical mistrust and the fear of going to the doctor. And I mean, I don't want to assume or, you know, generalize, but from my understanding, my knowledge of history, you know, Black people in general haven't always been treated the best in the medical community. We were the subject of test experiments for years, and can't, like, a lot of that stuff. So that just doesn't go away. You were alive for you know, for some of this stuff. Like, what can be done, or where is that, some of that mistrust rooted, that you guys think?
For me, and I recall all of the segregation and stuff when I was growing up and the different, but my father always wanted us to have it best. So he fed us and he took us to the doctor to make sure we were healthy. And you have to just put your trust in the doctor that you have. And I went to the same doctor that when I came back from the military, I went to my mother's doctor. And after a while, he told me, I got a new guy coming on. You guys can grow up together. And he's still my doctor to this day.
Wow.
And I go in, we have a great relationship. I tell him, just tell me like it is. Tell me what it is and what you recommend. And I put my faith in him, you know?
Yeah, man.
Because
I think too that, you know, you do have to just trust.
Yeah.
And if you don't trust them, then you move on and find somebody else. And you have to trust that they're going to do the best by you. I don't care if you're red, white, black, green, or yellow.
Yeah.
You know, you have to put your faith in the, you know, in the doctors and in God.
Yeah.
God will, you know, take care.
That is, that's great. And I love that, because that is the same thing that you guys have taught me about, like advocating for myself as well. If you don't feel comfortable with a certain doctor, or you don't like the way that, you know, like the visit went, that doesn't mean that you have to stay with that doctor. So advocating for yourself, speaking up, and the same thing with therapists. Like, you know, I did the same thing with therapists for years. And just because I didn't have the best experience with this therapist in this city and this time on this date doesn't mean all therapists are bad. Doesn't mean all therapists don't get me. It doesn't mean that therapy doesn't work. It just means that I need to continue to advocate for myself, and I got to continue to look and search until I find that. That is why I have been able to accomplish what I've been able to accomplish. That's why I'm where I am today. And I just, I hope that, you know, I know that you guys are definitely proud, but I hope that you guys are here, and I hope I'm here long enough to continue to see the fruits of your labor and all of the stuff that you have continued to just invest in me, and seeing other people, you know, benefit from that. Because I mean, it's extremely profound when you think about it. I'm just extremely grateful for it.
Been through a lot. You kept your head up. Never heard you complain. And I'm thrilled to be sitting here. don't want to get emotional.